All right, it looks like our recording has started. So welcome to our week 4 live session for MCCG 223. Today I'm sharing my screen. Today we're going to go over a lot of coding practice. I'm going to talk about some guidelines as we go through these coding cases. We're going to go through urinary, male and female genital system coding, and then maternity care and delivery coding. I also want to talk a little bit about maternity care and delivery coding because the codes are totally changing as of January 1st of next year for those maternity care services. I shouldn't say totally 100% changing, but a lot of them are changing. There's going to be a lot of kind of craziness going on with maternity care. And so we'll kind of talk about that. Okay, so without further ado, again, if you have your CPT code books, go ahead and get those out because we are going to do a lot of practice with this. And if I'm going too fast, please tell me to slow down, raise your hand, or add it to the chat. I can see the chat. If you're watching the recording and I'm going too fast, just pause me and then see where you can get. So hopefully that helps. And let's get started. Do I want to share my camera yet? Nah, I don't want to share my camera yet. Okay, so you can see my screen. Here we got urinary, male and female genital systems, maternity care and delivery. I'm going to just do kind of a brief overview of each one of these systems, and we're just going to jump into coding. So the urinary system is divided into two parts. You have that upper urinary system that includes the kidneys and the ureters. So the kidneys obviously filter the blood, and then the ureters take the urine to the bladder. And these are all bilateral. So a couple things to pay attention to when we're coding for the urinary system is right side, left side, bilateral, unilateral. The lower urinary system, it contains the bladder and the urethra. The male and female reproductive systems, the female reproductive system, interestingly, with all of these surgical systems within organ systems within the surgical section, excuse me if I say that right, they're all kind of organized from top to bottom. So if you're looking at the organization of the book, those sections in the book, they all go from like north to south, right? So urinary system goes from the kidneys to the urethra. Same thing with the female and male reproductive systems. The male, not so much, but with the female, it definitely starts up here with the uterus, fallopian tubes, and goes down, goes down to those other systems. The male genital system is an interesting kind of section in the CPT surgical section. There's lots of different anatomical areas or locations within the male genital system. Not a lot of things that can be done to a lot of these organs. So there's just kind of a lot of different little sections. So just be careful about like what structure the procedure is being performed on. We'll kind of go through all this as we get to coding. Maternity care and delivery. So the maternity care section is specific to it. You're not talking about female genital. We're talking about obstetric, right? So think of that as kind of a differentiation. Is this patient, the patient could be pregnant, right? And still have a female genital system surgical procedure, regardless of whether or not she's pregnant, right? However, those obstetric, maternity care services, those are all going to be obstetric services, right? So pay attention to if you're like, oh, if it's an IND or a DNC, a dilatation and curettage, is it for obstetric reasons or is it for non-obstetric reasons, for example? So again, that maternity section, we'll talk about when we get there. I'll talk a little bit more about it. I have just a little thing here for phases of pregnancy that's going to come up. So we'll talk about that as well. Oops. And let's code. So that was a lot very quickly. So I'm going to change my camera to my CPT code book here. All right. Let me know if you guys have any problems seeing my code book, if it's too big, too little, if it's, I don't know, unfocused or anything like that. All right. So let's just jump into it. We have, I think, I don't even know, lots of slides, 50 slides. We're going to do lots of practice today. So let's look at this one. This is a urinary tract one, I believe. Yes, urethral stricture. So we have Mike Talley. He's a 32-year-old male who was diagnosed with a urethral stricture. The physician performed a dilation of urethral stricture by passage of filiform and follower. Which CPT code should be assigned for the procedure? Okay, so let's think about what is the two questions that I always have us ask is what did we do and why did we do it? In this case, we know that this patient has a urethral stricture that would be reported with an ICD-10-CM diagnosis code. The CPT code, however, is going to be reported with, for the dilation of the urethral stricture. So again, we're going to ask ourselves, if we're like performing, if we imagine the provider performing this procedure, what verbs, what action words, what are they actually doing to this patient? That main term is going to be dilation, right? So if I'm coding this, I would probably look up dilation first. You could also probably look up urethral stricture first. It might show it, it might get you there. So I'm going to go ahead and do dilation. I'm going to look for dilation. And then I'm going to kind of guide us through a few of these, and then I'm going to have you guys probably start to work on some of these yourselves as well. So if you want to be prepared to add some information to the chat. Okay, so I have the word dilation up here on page 1151. It's on the right-hand column, kind of at the top third. So what are we dilating here? We're dilating the urethra. So I'm going to flip the page. My son is calling me and he's in the living room. Okay, so we're going to have a dilation, do a dilation. Let me make this closer. Dilation, comma, urethra, right? And then you can see, and so this is on page 1152 on the left-hand column. Urethra is down here, kind of in the middle of the page. Looks like we have a lot of options, but under urethra, we also have stenosis and stricture. So we know here up on the slide, it says stricture, right? So we know we're going to be coding for the dilation of a urethral stricture specifically, but then we still have a lot of options. 1, 2, 3, 4, 5, 6, 7 different codes. It looks like there's a number. So let's go ahead and just look. We have 52281, 53600, 01, 620. So it looks like they're all kind of in the same area. Let's go ahead and I'm going to put a pen or something over here. 52281 is the first one I'm going to look at. Bookmarks are your friends when it comes to CPT coding, I think. Sometimes I'll have pens and I'm going to like, I can't find my pen all week long, and then I open my book and I find my pen because I left my pen in my book. All right, 52281. The first one in that list is on page 415. 52281 is a cystourethropy with calibration and or dilation of urethral stricture or stenosis. All right, so that is not what we are doing in this specific example, right? So this is a cystourethropy with calibration. We didn't do that. All we did was the I can't say this, dilation of the urethral stricture. Okay, so let's look at a different one. Going back here, we have urethral stricture 53600, basically 53600 through 53665. All right, looks like they're all right here on page 420 on that top right-hand column. Okay, so notice you're in this manipulation category, which is correct, right? Manipulation is when you're kind of moving or changing the structure of something, and that's what we're doing in terms of dilation. Okay, so 53600 is dilation of urethral stricture by passage of sound or urethral dilator, male initial. 53601 is subsequent. There's nothing here that says it's subsequent, so we know it's not 53601. 53605 is dilation of urethral stricture or vesicle neck by passage. Oh, sorry, I kind of forgot that, right? How did we do this? We did this urethral stricture dilation by the passage of filiform and follower. But here, 53600 says we did by passage of sound or urethral dilator. We didn't do that, right? So we know 600, 601 are no good. Let's see 605. Dilation of urethral stricture or vesicle neck by passage of sound or urethral dilator, same thing. So no. Oh, this one is under general or spinal anesthesia. No good. So it's not those three. Let's check 53620, dilation of urethral stricture by passage of filiform and follower, male initial. All right, that looks pretty good, right? So we have the dilation of urethral stricture by the passage of filiform and follower. We're going to select 53620 because that's the initial service. 53621 is going to be a subsequent. We didn't do subsequent. I mean, you can look at the other ones. 660 is using a suppository or insulation, initial or subsequent. And then 53665 is the dilation of a female urethra. So 53620 has got to be our correct code. Thank you, those of you who put your answers in the chat. Great job. Hang on a second. My children are calling and texting me, even though they are in the house. I don't know what these kids want. Okay, so yay, 53620. That's our answer. Good job. Next, coding practice. Okay, next scenario here. A patient comes to the emergency room with abdominal pain. After tests were performed and the patient was diagnosed with an abscess of Skene's gland, the physician performed a drainage of the abscess. Which CPT code should be assigned for the procedure? I am going to give you guys a couple of minutes, just because I have to see what's going on with my kiddos really fast. So I'm going to mute myself for just about 1 minute, and I'll come back and we can look at the answer for that one. Okay, thank you for being patient with me. I apologize. The joys of working from home. One of my kids, he's type 1 diabetic, he's on insulin, and the other one just broke his lava lamp and there's glass all over the floor. What are you going to do? Take a deep breath. We're good. Okay. So thank you for those of you who put an answer in the chat. I apologize again. So here we're going to be performing a drainage of the abscess of the Skene's gland specifically. Sorry, I had to run up and downstairs. So that code is going to be 53060. So thank you again for those of you who put that in the chat. Great job. This one is an interesting one. So 53060 is on page 419. It states drainage of Skene's gland, abscess, or cyst. So a lot of times you're going to have like drainage of abscess or incision and drainage or an IND procedure. But when it comes to this one, you'll note that it's specific to the Skene's gland. It's in that urethral system subsection. Okay, I'm going to catch my breath. All right, so next one. Tina has been experiencing stress incontinence for 6 weeks. She went to her physician where she performed a surgical laparoscopy of the urethra with a sling operation for stress incontinence. What is the correct CPT code for this example? Now, this one is an interesting one, I think. How are we going to code this? Ooh, dropped my pen. Or rather, I should say, how are we going to look for this, right? So you have it's a laparoscopy, laparoscopic procedure of the urethra, excuse me, with the sling operation for stress incontinence. So I think there's a couple of different ways. It's not like there's just one main term here. I would probably start with sling operation because that kind of describes the operation, right? If that didn't work, I would go to stress incontinence, maybe see if we could find it that way. So I'm going to start with sling operation, see if we can find it this way. Oh, look, there it is. It's on page 1307. So you have sling operation. You have one for incontinence, removal, stress incontinence, and vagina. So we know here that this is specifically for stress incontinence as per our coding practice scenario here. That gives us two options, 51992, 57287. So let's go to 51992 first. Okay, so 51992, it's on page 413. It's on the right-hand side of the page. I'll go a little bit slower here. 51992. It is laparoscopy surgical. Okay, good, because we know it's laparoscopic, right? Because it states it here, laparoscopy. And then sling operation for stress incontinence. Sounds pretty good to me, right? 51992 looks good. Let's look at that other one just to be sure. Where was it at? The other option was 57287. Five seven two eight seven is removal or revision of sling for stress incontinence. So yep, we know we're correct. Interesting here, and this is an important thing to note. So notice that the correct code here is 51992. But if we're doing a removal or a revision of that procedure, I'm sorry, yes, let me finish my thought. 51992, which is in the urinary system subsection, but this other code, 57287, that's in our female genital system subsection. So there's be careful when it comes to urinary and male genital system codes. Sometimes you're going to find them in the urinary system because the urinary system applies to the entire urinary system, but there are also differentiators within the urinary system subsection between male and female, as we just saw with that first one for that urethral stricture, right? Because this was specific to a male. But then sometimes the index is going to throw you to a code that's in the male or female genital system rather than the urinary system. Just do what the book tells you to do, right? If the code is correct, that's all that matters. Next, Lester is scheduled for an outpatient procedure for transurethral drainage of a prostatic abscess. The procedure was performed without any complications. Which CPT code should be assigned for this procedure? Okay, so what are we doing in this place? Hey, situation. I gotta slow down. It's been a long day. He's scheduled for an outpatient procedure for transurethral drainage of a prostatic abscess. So that's what we're doing, right? We're draining that prostate abscess. So I'm gonna go to drainage, see if we can't find it. drain, drainage, lots of drainage stuff. So when we go to drainage, I'm finding it on page 1154. What are we draining? We're draining an abscess, and the abscess is on the prostate. So you have abscess, and then you have all of these areas. There's prostate. Okay, so I'm finding prostate kind of down here in the bottom third. We've got prostate, and we have three different options: 52700, 55720, or 55725. So again, you can see one of these is in the urinary system subsection, and the other two are in the male genital system subsection. So it just, sometimes it goes all over the place. So let's look at 52700 first. Was it? Sometimes it just goes right. Okay, 52700. All right, I am on page 419. 52700 is, it's at the top left-hand column, transurethral drainage of prostatic abscess. That looks pretty good. I'm not seeing anything here that would make me, yeah, and it's transurethral. Yeah, I wouldn't see anything here that would make me think that that's the incorrect code. So in this case, I'm not even gonna go check the male genital. We're not gonna waste our time, right? This has got to be the correct code. And yep, that's it. Oh, this says click to watch video. None of these, this might work. I don't know. Don't trust it though. If it leads you somewhere crazy, I apologize. Stacy physician performed a surgical laparoscopy ablation of renal cysts. So this is a pretty kind of simplistic one here. So what are we going to look up? I'm going to ask you guys in the chat. What are we going to look up in the index? Stacy physician performed surgical laparoscopy ablation of renal cyst. What's the main term here? Okay, I've got ablation, ablation. Laparoscopy, good question. Got one more coming in, give it just a second. In this case, we have to think of what are we actually doing. Yes, this procedure is laparoscopic. So whatever we do, we definitely want to make sure that we account for the fact that it's a laparoscopic in approach. But when we're in there with that laparoscope, right, via this laparoscopic approach, what are we doing to this? So ablation is what I would look up, because that's the main term of the surgical procedure, I guess, right? So what are we doing to these renal cysts? We are ablating them and essentially like destroying them via means of a surgical laparoscopy, right? So in this case, I'm going to look up ablation. Ablation. It's on page 1094. It's actually the first page of the index. And it is ablation of what? Renal cyst. Oh, it's actually in there under renal cyst. So it's on page 1095. I was going to look up for like ablation, comma, cyst, comma, renal. But in this case, if you go to ablation, there is no cyst. So you'd have to go to renal cyst, which is right there on page 1095. And it's going to lead you to one option, 50541. Are we going to code from the index, or are we going to go make sure this is the correct code? We definitely have to go make sure that this is the correct code. So I'm going to go check it out. 50541. Laparoscopy, surgical ablation of renal cysts. Perfect. That's on page 405. So it's important, right? Even if there is only one option in the CPT index, um, that's correct. Thank you guys for answering in the chat. Even if there is only one option in the index, 50541, why do we still have to check? It is important to check because sometimes, and in this case, we have a couple of important guidelines, right? Many times there are important guidelines. You're going to have parenthetical notations. You're going to have all sorts of notes. You could check and see maybe that's not the correct code, right? It's you always have to just double check, right? So here under laparoscopy on page 405, it does say surgical laparoscopy also includes diagnostic laparoscopy. To report a diagnostic laparoscopy, use 49320. So this is when you, like in the real world, you would go back to your surgical case and say, make sure, oh, this wasn't diagnostic. We actually did this ablation, right? So again, it always really helps. It's necessary to always look in the main section of codes and verify that code. Pop quiz. Oh, pop quiz time. So in the chat, when applying add-on codes, do you include the plus symbol, that plus, when documenting your codes? Yes or no? And so what I mean here is, like, if you see that plus symbol next to a code in the book, in the real world, when you're entering that code into your electronic medical record system or on an assignment, do you add that plus sign? A couple answers. Okay, you guys are doing a great job. Yes, the answer is no. You do not add the plus sign. The plus sign, and it's good because it looks like a couple of you guys had some question marks there, like, no, not really quite sure. So yeah, this is a good thing to talk about. I don't know if we can find one really fast. There's not a lot of add-on codes in the urinary system section here. But when you see one of the codes in the CPT code book, oh, here's one on page 417, just for reference, you have add-on code 52442, or yeah, that's it, 52442, for like each additional blah, blah, blah. The plus sign in the CPT code is only there to indicate to you as a coder that that code must be added to something else. You can only report that that add-on code, if you've reported the primary service procedure. And it will always tell you use 52442 in conjunction with 52441, or use whatever that add-on code is in conjunction with that primary service code. So again, it's just to indicate to coders that it's an add-on code. You can't report it by itself. You have to add it to the other code. In the real world, when you're actually coding and you're adding these codes into the EMR system, you just add the code. There is no add-on code. I think even if you tried to put an add-on code, the system probably wouldn't let you, or it would pop back to you saying it was an invalid code because that plus sign was there. So yeah, no plus sign. Good job. Next one, ureteroplasty. How far are we doing? We're about halfway through. I'm going to skip this one. Oops. Because I want to get down to, we only have about half an hour left, and I want to spend some time on maternity care and female and male genital. Let's skip the Foley. I'm going to let you guys, I will post this slide deck to the class announcements, so that you have access to this, and so that you can kind of go through and go through those ones that we skipped. So again, give us a hard one. Oh, okay, let's see if we can find a hard one. Let's see if we can do this one. Melanie went to the outpatient clinic for an endometrial sampling biopsy with endocervical sampling without cervical dilation. So we got a lot of stuff going on here. The patient tolerated the procedure well and was discharged home. Which CPT code is assigned for this procedure? All right, where are we going to start? We have a lot of stuff going on here. Endometrial sampling with endocervical sampling without cervical dilation. I don't even know what to look up. What would we look up? Maybe sampling, biopsy, maybe, right? Because we are doing a biopsy. So let's see if we can find it under biopsy. Let's see if we can get lost a little bit. Sometimes I like to try to get lost so that we can get found. That's funny. Okay, biopsy. So what is the biopsy of? It's of the endometrium, because it's endometrial sampling, and endocervical sampling. So it's going to be the endometrium and then that cervix. So let's see if we find biopsy, it's on page 1115. I'm just going to see if we have anything. Endometrium. We do. The endometrium is on page 1116, 58110. I'm sorry, 58100 through 58110. It's a lot of codes. And then 58558. Let's see if we can find it. So let's go to 58100. Female genital. All right, 58100 is on page 442. 58100 says endometrial sampling biopsy with or without endocervical sampling without cervical dilation, any method. Well, that's our code. That's it. 58100. That one was honestly a little too easy. It looked like it was going to be harder, but it was easy. Yeah, that's it. Well, bummer. Let's see if we can get, I don't know how many hard ones are on this presentation. Let's check this next one. Sorry if I'm going too fast. Please let me know. Sarah took her newborn baby boy in for a checkup. She's worried about the baby not being active. The physician performed a fetal non-stress test to ensure the baby was healthy. Which CPT code is assigned for this procedure? This one's not very hard, but let's go ahead and look at it anyways. So this one's weird. What would we look up? You guys tell me in the chat. What are we looking at? Fetal? Stress test? Non-stress test? Fetal stress test? Non-stress, right? There's a couple. So I've got pretty much all of these options in the chat right now. Fetal stress test or non-stress test. So we could probably look for it a couple different ways. I'm going to go ahead and I'm going to see if we can find it a non-stress test because it is a stress test, but it's like the opposite of a stress test. Non-stress test, fetal. Oh yeah, that was too easy. These are a little easy. So yeah, you're right. On page 1249, we have non-stress test, comma, fetal. 59025. I want to see if we can find it under stress test too. You guys can go ahead and check it. Let me know if that's the correct code while I play around in the index here. Stress test. No, it's actually not under stress test. Under stress test, there's cardiovascular, multiple gated acquisition, pulmonary. Nope. It might also be under fetal. Yep, that's correct. Good job. Yeah, 59025. That is the code for a fetal non-stress test. Another thing, or one thing that is interesting about that code is, let me find it. It is actually in the I'm not sure about this scenario because a newborn baby boy, I don't think they do fetal non-stress tests for babies that are actually delivered. They do them what's it called, percutaneously. Anyways, so this 59025 is the correct code. But notice it's in the maternity care and delivery system section because this is a system that is performed on the fetus while the patient, the mother, the pregnant female is pregnant with that fetus, right? So it's in that maternity care system. You'll see other stuff going on. So you've got, these are just kind of jumping ahead here, but it's good to note. On page 448, you have antepartum and fetal invasive services. And so a lot of these, you've got like amniocentesis, there's fetal contraction stress test. So like a fetal contraction stress test is going to monitor, and you can see kind of on the screen here, the fetus's reaction to contractions. Sometimes their heartbeat will drop, sometimes I guess that's all they do is they monitor their heartbeat, right? And so we're performing a test on the fetus, but the fetus is still inside the mother, essentially, the pregnant female. And so in this case, the service is actually being performed on the pregnant female. And this 59020 or the CPT 959025 are billed on the mother's medical record, if that makes sense, right? On the mother's account, because the baby, the fetus, being not born yet, all of the services are for the pregnant female, and none of them are for the fetus until after that fetus is delivered. So interesting to note there. Okie doke. Let's talk about a prenatal visit. Let's see. Stacy went in for a prenatal visit. Dr. Leslie determined there was abnormal fetal fluid pressure on Stacy's fetus. The doctor performed a drainage of fetal fluid to decrease the pressure with ultrasound guidance. Which CPT code is assigned for this procedure? I bet you it's going to be around this section that we were just looking at here, right? So if you look, okay, so drainage of fluid, the fetal fluid, let's just do some medical terminology really fast. Fetal fluid, what's the term for fetal fluid? Amniotic. Okay, good job. So if we're looking at, oh, yep, it's right there, 590. You guys are too fast. Okay, so it's amniotic. And then what is the term for centesis? Oh, I just told you. The term for drainage is centesis, right? So amniocentesis is also can be performed either for for reducing fluid. So that's probably where I would start, would be amniocentesis. So in this case, oh, I'm a little conflicted here. Yeah, the code is 59074. See, this is why you don't code from the book, because here 59001 says therapeutic amniotic fluid reduction. Oh, it's because that includes ultrasound guidance. That's why. It does have ultrasound guidance. Well, see, I'm all messed up. Okay, so 59001, but my answer says 59074. 59074 is specifically fetal fluid drainage, vesicocentesis, thoracocentesis, paracentesis, including ultrasound guidance. So that's going to be the correct code simply because it's the more accurate description of the procedure that was performed. So yeah, that's me trying to skip around and do an easier job, but that's how it backfires. Let's do another one here. Heather went to the hospital for cesarean delivery only. Which CPT code would be assigned for this procedure? Now this one I am going to show you directly because I know where this one is. You're going to go to delivery in the index. Then there's a bunch of types of delivery, right? Delivery only, delivery, there's 4 different types of delivery. There's vaginal, cesarean, vaginal after, vaginal after cesarean. And then there's attempted vaginal after previous cesarean, which is actually transitioned to a cesarean. So a couple of 4 different types there. 59. If you go to go to page 450. And these are all of our OB service codes. And so I guess I'm going to use this opportunity to talk about these codes right now. So if you look on page 450, that's you have, so to close my thought here, cesarean delivery only would be billed with 59514, which is there on page 450, cesarean delivery only. So notice here you have different types of delivery in the book. You've got vaginal delivery, antepartum and postpartum care, cesarean delivery. Then if you flip to page 451, you have delivery after previous cesarean delivery, and you've got a couple of different options there. Okay, so in this section, and hopefully you guys remember this from your prior CPT coding classes and your experience, we have what are called global codes, routine global obstetric care. So if you look on page 450, you have CPT code 59510. That is the routine obstetric care, including antepartum care, cesarean delivery, and postpartum care. So that means, so if you've ever had a baby, if you've ever been pregnant, you might know it takes a while, right? You have to go to the doctor, you go to the OB for throughout the first trimester, the antepartum service, part of your pregnancy, throughout those trimesters, and you get any number of services based on medical necessity and your risk profile, all of those antepartum services. It's usually 9+, I believe, is kind of what, or 7 or more, I should say, 7 or more antepartum services. More than seven, that's the word. And then this code, so that's what this code includes, 59510, that's the antepartum care. That includes the delivery as well. So in this case, this isn't a cesarean. I guess it is a cesarean delivery picture, right? So they incise the patient's abdomen, the uterus, and then they pull out that baby. So that's the delivery. And then the postpartum care. So the postpartum care includes whatever routine postpartum follow-up that patient receives. All of those services for like 10 months or more are rolled into one code, 59510. Right? So after that baby is delivered, usually we drop those codes, we report those codes, or that particular code, I should say, at the time of the delivery. And you kind of have to wait to get paid for your OB patients until after that patient delivers. Unless the patient transfers somewhere else or something else happens, right? So that's kind of the world that we live in now. If the patient just receives, a few antepartum care, let's say we have a patient who came and established OB care, and then she moved out of state, right? Then you have codes 59425 and 59426 for 4 to 6 or 7 or more antepartum services only. All you did was that antepartum care. You didn't do the delivery. The patient moved before she delivered. On the other hand, if all you do is just the postpartum care, there's a code for that, 59430, right? Other than that, the vast majority of the time, we're reporting the global service code. Okay, so what is changing as of January 1st of 2027? And I'm going to open this up just to give you guys a peek. And I posted this in the announcements. Maternity care services, all global codes are being deleted as of January 2027. I believe they're deleting 17 different codes, and they've created a number of codes. You'll see one thing that's kind of missing from this section in the book is labor management. There are no codes for labor management in the CPT code book as it exists today. So if it was like a complex labor or a simple labor, there's no way for our providers to take that into account in their billing. They just report this global code. And so sometimes they get kind of shortchanged to a certain extent. So the AMA decided to get rid of these global codes. Have been around for over 30 years, I believe. They're deleting the global codes. And essentially at this point, everything is going to be itemized. Every single antepartum service is going to be reported with the appropriate E&M. Here it is. Antepartum care is reported with the appropriate evaluation and management codes, e.g. other office or their outpatient services. It could be a telemedicine. It could be performed in the home or residence, right? It could be performed in the hospital, right? So any antepartum care definitely after January 1st, is going to be reported with just a regular old E&M code, right? And then you still have your fetal invasive services, labor management. So all of these codes are brand new. These are codes specifically designed to identify that integrated decision-making to assess, support, and balance the well-being of the parturient, i.e. the pregnant person who's in labor, the fetus, managing medical conditions, complications, right? So all of this labor management, there didn't used to be a way to report any of this. I'm going to scroll down. Yeah, labor management is divided into straightforward versus complex. Essentially, any patient who has multiples, more than one fetus, automatically turns into a complex. Yeah, any previous cesarean delivery is automatically complex. it doesn't say necessarily that any cesarean delivery is automatically complex. Not that I'm finding. But those probably would fall into the complex category simply because why else are we, uh, calling it complex? Okay, what else? So these are all new. Notice they all have, so this is what your book is going to look like. It's going to have these little red dots. These are all new codes. Then you have labor procedures. I'm just going to skip through some of this. Yep, lots of deleted stuff. Delivery care begins when labor is complete. Okay, and here we have our deliveries, finally. Vaginal delivery. We have a couple of new codes here, with or without episiotomy, and then after previous cesarean delivery. So our VBAC patients, our vaginal birth after cesarean, they've clumped them into this vaginal delivery group. You got repair of episiotomies, which is great because in the real world, we see lots of our OBs will do repair of third degree and fourth degree lacerations. And there was no way to code for these before. Sometimes they can be severe. So it was really hard to capture that additional work. So now we have these codes for this, which is like amazing. And you have codes for cesarean delivery, primary or repeat. Subtotal or total hysterectomy after cesarean. Again, I'm not going to go through all of this. I did put in the, I put this attachment in the announcements. I would suggest I would suggest saving it or printing it out. If you are testing prior to, well, let's see, it's 2026 now in July. If you test prior to the end of the year, you're going to be fine. Use the old codes, right? However, if you're taking a certification test after about May of 2027, usually the certification exams will update in the May-ish timeframe of each year. So make sure that if you are testing about like after May of 2027, you pay attention to these changes, or you're going to need to know these changes for the maternity care system. If you're testing before that, you will not need to. However, that's for testing, right? In the real world, if you're coding for any kind of OB services, these are already hitting the complications kind of coming up because of these changes. It's already starting to hit our providers. So anyways, it's good stuff to learn. Heads up on that. Make sure you save this, download it, read it, whatever you got to do. And then just, again, be aware because it's going to be a big change for anyone who codes for OB services in the future, starting now already. Okay, long story short, that's what it was. So we have about 9 minutes left. I'm just going to keep on going. Oh, look, we have a male genital. Lee was admitted to the OR where an excision of vasectomy, bilateral, was performed without any complications, which CPT code would be used for this procedure. So this one's pretty easy. Let's look it up. What is our procedure we're going to look up? You guys tell me in the chat. What are we looking at? Excision, vasectomy. Ah, I like it. Excision or vasectomy. So that's really good that you guys both put that, excision or vasectomy. In this case, it is an excision of vasectomy. It's kind of a funny way to put this, actually. I would say just a vasectomy. So so we're going to look up the word vasectomy because in this case, that's just kind of the general term for that procedure, right? Technically, we are excising a portion of the vas deferens, which is that little tube that holds the seminal fluid, right? And so they actually cut out like a centimeter about of that vas deferens, which is like it looks like I had a friend once whose husband got a vasectomy, and they showed it to her. She said it looked like a macaroni noodle. You probably didn't want to know that, but let's see. So vasectomy is on page 1337. We have a couple of different options. Laser vaporization. We're not doing a reversal. It's not transurethral. It's none of this other stuff. So I'm just going to look at this default code 55250. And this is an example, kind of an example of what I wanted to talk to you guys about in terms of the male genital system subsection. You can see kind of on the page that we're looking at here. So 55250 is on page 429. That's the correct code. Good job. Thank you. But notice on this one page, we literally have 4 different anatomical structures. So you have scrotum, and then there's only 1, 2, 3 different types of procedures: incision, excision, or repair. The vas deferens, there's only 4 different things. We can incise them, we can excise them, an introduction procedure, or repair, right? Same thing for spermatic cord, excision or laparoscopy, seminal vesicles, incision, excision, and that's it, right? So that's what I meant when I said that the male genital system subsection coding is very interesting, because it's just got a lot of these kind of little different anatomical structures, not a lot of different or multiple types of procedures that can be performed on those different structures. So just make sure that when you get in there, right, you're what am I trying to say? You're correctly identifying the anatomical structure, I should say. All right, 55250. Next, we might, what's going on here? Let's not start about that one. Okay, we talked about maternity. Let's do this one. Robert was admitted to the outpatient center for an excision of renal biopsy, percutaneous by needle. All right, I'm going to let you, this one might be a little bit harder, hopefully. I'm going to let you guys do this one. I'm going to give you like 60 seconds or so. See what you can find. So it might be a little bit difficult. I guess it's not worded very well here. So what are we doing in this? We're excising excision of renal biopsy. So what is the actual procedure we're doing here? Yes, we're excising something, but it's for the purpose of a biopsy, right? Oh, we lost on this one. Hmm. I don't know. Anybody find this one yet? Has anybody found it in the index? And what did you look up? Or if you haven't, just put a question mark in the chat. Question mark, question mark, question mark. I'm with you guys. I'm with you ladies. All right, so let's see. I looked up excision, it's not in there. I looked up renal, that's where I am right now. Goodness gracious. Renal biopsy. Where is renal? Goodness gracious. Renal. So there's renal abscess, renal arteries, renal autotransplantation, renal calculus, renal cyst, dialyses, disease services, and renal transplantation. So it's telling us we're doing an excision of renal biopsy percutaneous by needle. I don't even see anything here that is percutaneous in nature. Did anybody look up the word percutaneous? Performance, percutaneous procedures. Renal biopsy, excision of renal biopsy. Well, here's our hard one. There's a renal angioplasty, but I don't see anything else. Percutaneous. Okay, the only other word I haven't looked up yet is needle. I'm going to look up needle. Oh, did you find it? I just looked in the chat. Needle biopsy kidney. Needle. Okay. This is a sneaky one, huh? Needle. Needle biopsy. So it's a needle biopsy. What are we needling here? We don't have the word renal. Okay. So what are we going to do? What does renal mean? It refers to the kidney, right? So anatomy, medical terminology is important. And then we do have kidney, needle biopsy of the kidney, and it's going to lead us to 50200. 50200. It's on page 400. Cheese and crackers. Renal biopsy, percutaneous by trocar or needle. So that's our code. All right. Now, yeah, good job. What are you going to do if you come across something like that on the CCS or the CPC certification test? Are you going to stress out? I think that was a really good kind of example of I don't like the CPT index. I've never liked the CPT index. It's cry. No, don't cry. So you got to get yourself through these, right? So that you don't cry when it really does count. That's why we have to practice. The only thing, right, what I did, I started with something that I thought we looked up literally everything. I looked up excision, renal, biopsy, percutaneous, and then finally needle. Of course, it's going to be the last one that you look for, right? So just kind of go through the motions. Sometimes the index will lead you on what I like to call a wild goose chase. You're going back and forth. You can't figure these things out. You can't find it. What are you going to do? Just keep following the process. Eventually, you'll find it. If ultimately you are in a coding test or a certification exam, and you literally cannot find the code for this procedure, skip it. Just skip it. Don't waste and get too frustrated, right? The chances are you're going to get it wrong anyways at that point, right? And I don't say that because I want you to feel frustrated, right? Or say, oh, I'm not going to get it right. But cut your losses and move on to a question that you know you can get correct. If you have the ability to like hold it and return back to that question later, then absolutely do that. If not, make your best guess and or skip it, and then move on to those questions that you know you can get correct. So yeah, that's a good one. That one was a hard one. Yeah, in the chat, there's it says, I learned from my first exam not to spend long on a question. Yeah, you can't do it. It's depending on the test, you have anywhere from like 1.5 to 2.5 minutes per question. And so sometimes you can bank some time if you go through some questions really quickly. But man, if you're stuck for 5 minutes even on something like this, it's already way too long, you know. And then you have to think about your mental state, and you're frustrated and you just want to get going, and don't frustrate yourself, right? So just skip it and move on to something that you know you can get right. Okay, so it is at the end of the hour. I'm going to call it a night. It looks like there's probably 2 more cases here that we have not yet had a chance to go through. I am going to, again, post this slide deck in the announcements so that if you want, you can open up that slide deck and kind of test yourself. Obviously, the slides, there's the case study on the one side and then the answer is on the other side, so you can kind of test yourself. I think we skipped a couple earlier on as well. So yeah, I'm going to stop sharing. I'm going to stop right there. Does anybody have any questions, comments, concerns? hopefully this was helpful. I'll see if I can come up with, I obviously borrowed this slide deck. Um, so I'm going to see if I can come up with another slide deck for the next live session with some more complicated cases. Um, what's coming up next? Now that we're done with this, it looks like we might still stay in the surgical section for a while, but I'm not sure. I'll see if I can come up with some more complicated stuff. But any questions, comments, concerns before we call it a night? Nope. All right. Well, I hope you guys have a great night. Happy week 4 and happy coding.